Now, with many changes happening to the NHS nationally, what does the future hold for health services in the Solent region? Well, that's the question the Solent NHS Trust looked to answer at a special event in Southampton. Our reporter Richard Ensten has more.
Most people are familiar with the National Health Service, and almost everyone has benefited from it at some point. But what exactly does the Solent NHS Trust have in its remit?
So we provide services in both cities, Portsmouth and Southampton, and we provide services across the county of Hampshire as well. In the cities we provide both services for adults and services for children, and in Portsmouth we provide the mental health services as well. So a lot of the out of hospital services, so not the big acute hospital, the services that are out of hospital are provided by us. We're the main provider of those. So I think we're a strong and a big partner within the community, within both of the cities. So we feel, and we've got a history, we've got relationships with people that work in the cities, so we feel that's very special for us to try and work differently with the people that live in the cities. The services we provide across the county are slightly different. Our sexual health services, our dental services and our paediatric therapy services we provide across the county. But in the city it's the services with district nurses, health visitors, general practice in Southampton City, and as I said, mental health services in Portsmouth.
The Trust provides a long list of services, and the experience can often be overly complicated and confusing for patients. It's a problem they're looking to address.
I think what's really, really important is it's not about an individual organisation, it's about us working with partners in a community to provide better care. And the reason sometimes that care can appear disconnected or fractured for people that use the services because it's different organisations that don't work as well as they could together or don't talk to each other as well as they should. So what we're doing is trying to work actively with partners and integrating our services, in other words putting together our services with others so that they work much more effectively. An example would be putting together the nurse and the social care staff, the domiciliary care staff, who are often providing care for the same person in their home, and putting that together in a way that works for the person who's receiving the care just seems like the right thing to do. It's the best thing for us, best thing for the patient. And actually, if we do it well, we can do it more effectively and we can save money that way as well.
As far as saving money goes, it's all about trying to become as efficient as possible.
I think it would be wrong for me to say that there isn't financial challenges within the NHS. We recognise there isn't enough money to provide the NHS that we've had historically, so we need to change what the NHS looks like. For us in Solent, in the last couple of years, we've had to work really, really hard to use the money that we've got to best effect. We've done that quite effectively actually, and we had a plan last year and we've delivered our plan. So we're an organisation in control with a positive future, but we absolutely recognise that we have to continue to be more and more efficient and save more money, and to do that we think that's about working differently with partners.
A growing and ageing population has put a massive strain on GP surgeries, many of which are unable to keep up with appointments. Solent NHS Trust hopes to tackle this by signposting people away from their doctors.
Health services and social care services can be quite expensive, and actually sometimes you don't need to use those services. So it's about, we describe it as navigating or showing people, signposting people to the right services, and some of those are self-help solutions like pharmacists and things like that. But for us with general practice, what we're really trying to do is to recognise that the GP can't do everything and shouldn't do everything themselves. So we support them by looking at other ways of working, so putting some of our nursing staff around the GP, putting some of our mental health team around the GP, putting some of our therapy staff around the GP, and actually introducing different roles into general practice, allowing the doctor to really see those that really need to see the doctor. So there's lots of things that we're trying to do so that we can provide those services 7 days a week, 8 till 8.
Looking forward, and the aspirations are for a seamless service across the Solent region.
For those patients who have very complex needs or need our services in an emergency, or just are using our services, those services are there. They're free at the point of delivery, and those services will always be there. What we hope is they may look different and they may actually work more efficiently. They may be more streamlined, they may be more intuitive, more common sense to people to be able to access. And I think there'll be a time where actually they won't know whether they're talking to a Solent member of staff or a member of staff from the council or a member of staff from the voluntary sector. They'll just be getting the service that they want.
Richard Ensten for That's Solent.